Everyone sitting at this table tonight wants to make a difference in the fight to stop diabetes here in the Rio Grande Valley. So grab a pen and mark your calendars. On Sunday, April 2nd, every part of the medical community is going to come together to provide information that will help you and your family arm yourselves with ways to improve your life. So we'd like to talk about April 2nd. It's a big day. Dr. Yaji, you're going to be there. Why is it so important?
It is a first-time event in the Valley and actually in a lot of areas in the United States that to bring everyone together, as we said in our discussion, together. We're here bringing here the patient first. Even we have the cities and the county help us to have from the colonial, everybody gonna have transportation like twice. It's an event start from 9 o'clock to 4 o'clock.
Yes.
We're gonna bring physician there and we're gonna explore to the physician, not how to treat diabetics. We're not here to treat diabetics, so actually how to be as a team, part of the team and approach that to your patient. We bring in from UTRGV, their expertise from each department. We have several sections going to teach about dietitian, nutrition, about sport medicine, about behavioral, nursing school, pharmacy school. It's gonna be unique, all day, bilingual. And the most important thing, we have some celebrity people who's going to bring it over, which is going to be a celebrity chief cook, she's going to be cooking, and we're going to have a demonstration in the stage. Nice. We're going to have some kind of, dancing and exercise and a lot of activity going on.
So Dr. Lieberman, tell me, why is it so important for UTRGV to be part of this as well?
Well, because it's important to the health of the Valley, and the School of Medicine is here to improve the health of the Valley. This is a big step, an early step for us to do that. One of the very exciting aspects is that we will have students not just from the medical school, but from several of our education programs, students coming to help with the patients as they get their screening and any of the other needs, also to help with the education. So it's education of patients, it's education of providers through the continuing education that Dr. Yaji was talking about, and education of others in the Valley about diabetes and raising awareness for what needs to be done and how we're all here to help. And this is not the end or the answer, it is the first step to making a big difference in diabetes in the Valley.
All right, so I'm going to ask this question. We have less than a minute. Give me quick thoughts. What is it going to take to end diabetes in the Hispanic community or in the Valley here? Quick thoughts.
To work together as a team, this is the only way to do it as a community, physician and patients.
Teamwork from the family's perspective and then also the healthcare provider's perspective, and both of them working together.
Okay.
Absolutely, the family component is going to be very crucial.
Yeah, everyone agrees that it's going to be it's working together.
It's going to take efforts on the part of the medical community working in partnership with the community. We have to take health outside of the hospital and start transforming the way people feel about this illness and promote hope instead of fear.
The families need to be primary in educating their children and the generations to come, because that's what's going to keep us healthy.
And I want to add just one last thing with Dr. Lieberman. We're using now the university, they're going to be carrying some kind of statistic and research. Therefore, we're going to have Anchor to start doing some study using this data when patient comes here and the health provider to see how we can make some change. I believe Dr. Lieberman knows this.
Absolutely.
What do you think, Dr. Lieberman? What is it going to take to end?
Well, it takes all of the above, because it's a chronic disease, it's a challenging disease to manage, but when the community helps promote healthy behaviors by making sure that food and activity sites are available and the families are working together to eat healthier and prevent diabetes throughout the family, because it is a family risk, and the doctors are supporting that, and the nurses and the pharmacists and the dietitians and the exercise physiologists and the promotoras, we all together.
It's a large group,
it's
yes,
a big
that does it
group,
together.
But it can be done. If everyone pulls the wagon in the same direction, we will move forward.
Esmeralda?
I think it's going to take communication with the patient, making sure we understand their lifestyle, understand what's going on at home, and understanding what the problems are. And then it takes the partnership in the community and the education with them so that we can try to implement practices. So it's a healthier community.
And Channel 5 really to coming forward and put this together. I mean, this is a big thing. I remember John when he came and he said we want to do. They took the initiative. This is what I think the career, what we are sitting here, we carry to the community through channel like that, media, and you played a big role on that. And bilingual.
We really do hope that our viewers watching right now, we want to thank you for joining us. We hope that you have received some great information tonight. If you'd like to watch the full conversation, we have that on our website on KRGV.com. We also hope that all of you will join us on April 2nd. That's at the McAllen Convention Center. We have lots of great people there to answer your questions and provide some much needed information. Have a good night, everybody.